Site Day 2020, and I have Dr. The name is
Dr. Kibata.
Dr. Kibata. Dr. Kibata in studio with me is an eye specialist. He's going to tell me the exact name also, because these medical terms become complicated sometimes. But karibu sana, Dr. Kibata.
Asante, brother.
All right. What is your title in particular?
So I am an ophthalmologist.
Ophthalmologist.
Yes.
All right, try spelling that as we figure out what is it.
Yes.
All right, so what is an ophthalmologist?
So an ophthalmologist is a doctor, first of all. So you umefanya
medicine 6 years.
Umemaliza, you have done internship 1 year, you have been registered by the medical board. Then you have worked a bit, so that you...
Experience is also very important.
Yes. Then you go back to the university for a master's of a minimum 3 years, usually 3 to 5 years. Then you come out, you work again for 2 years under supervision. Then now you are registered as a specialist, as an eye specialist by the medical board. That is an ophthalmologist. So an ophthalmologist is an eye surgeon who has also can sort you out. If they find a pregnant woman, they can sort out. You know, if you break a bone, they'll sort you out. But they have decided they'll specialize in eye care, in eye health. Yes. But there is also now several other people who are also in that space.
The eye space.
The eye space.
All right.
Yes.
We know opticians.
Exactly.
We were told who treats the eyes. Optician.
Exactly. And we found even in textbooks that's how textbooks are.
Yes, especially in primary.
Yes, that's how they're written. But so there's an ophthalmologist. Then there is what is called an optometrist.
Optometrist.
Optometrist is the person who determines whether you benefit from glasses, and if you do, what power, what lens, and how, you know, the power of that lens.
And what kind of lens.
And what kind of lens. Yes, that is an optometrist. And in developed countries, they are also taught some basics, emergency, so that they are able to tell you, Chief, you are going to lose your eye, go. You know, they're able to
so
kind of...
optometrist, is that a doctor or a physicist?
No. Optometrist is after high school, you go and do a BSc, 3 years.
All right, so you study light, you study lenses.
You study the optical system of the eye.
Okay.
Because you see the eye is a camera. So you just study the optics of that eye.
So a little bit the technical side.
Just the optical, the optics.
All right.
How do we get you in focus? Assuming that your eye is good.
Okay.
So the ophthalmologist is the one who will tell you, is your eye good?
Fast.
Fast.
And then this guy is going to determine
they tell you your eye is good, everything is fine. But you're not focusing. Go and see an optometrist. They'll sort your focus issue.
All right. So
then there's an optician.
Then there's an optician.
Yes. Now, once an optometrist tells you this is the lens you need, this is the power you need, the optician takes that lens and cuts it into the frame of your choice. So an optician is a technician. Juakali too. He's a guy who cuts, because those lenses come big. It's a big lens. But now, the frame, you might decide it's rimless, you might decide you want to wear Michael Jackson.
Does cutting it change the dynamics of
No. He has to cut it in such a way that it fits the frame and still is well-centered and does the job.
Everything is in place.
So that's an optician. That's the one who fits that lens into your frame.
Okay, I think we need to revise the syllabus in primary.
Yes. Then there's an ophthalmic nurse. An ophthalmic nurse now is a nurse. They've done nursing. Then they go back and do diploma in ophthalmology nursing. Because nursing in eyes is very different from...
Because the eyes are very, very sensitive.
It's a different animal altogether. Then, on top of that, there's also clinical officers. So you know the clinical officers, they do a diploma in medicine. They can also decide to specialize in eyes. So there's an ophthalmic clinical officer. You find a lot of them actually, they're the frontline workers in government hospitals. When you walk into an eye unit, most probably you're going to find an ophthalmic clinical officer. The frontline workers, very, very important cadre of workers. And in that, they can also decide to specialize in surgery, cataract surgery. So you become a cataract ophthalmic clinical officer. Yeah, they operate cataracts.
So there are levels.
So there are levels to all this.
All right, and you all work hand in hand.
We all work
together.
Yes, we all
Right.
work together as a team.
Everybody needs the other.
Yes,
in this
but
field,
but
right?
you see now, the problem now is to the general public, to the consumer.
Everybody is the same.
Everybody is the same, and everybody is an optician.
All right.
Because every corner of the street, there's a big sign, optician.
Can you see the adverts are all over? We see billboards.
Yes.
Yes.
Yeah. So yeah, that's the and unfortunately, because of ethics and lack of regulation, anyone can open an optical shop. You need a business license. Let me tell you, Barry. Yes, you enter City Council, will pay business license. Then you can open an optical shop.
I can start selling glasses.
Yes, yes. Without no training, you just need a white kabuti there, say computerized eye test, and you're in business. And because of that, there's a lot of mismanagement. There's a lot of fraud. There's just a lot of, wrong things. Because that industry.
Who's important? Who's in charge rather? Who's in charge of legislation that controls?
There's no one in charge of the optometrists. Yes, it is a bad situation in this government, in this country, where we have this cadre of people who are offering care to humans, but they are not regulated.
Without proper training, without regulation.
Yes, yeah. So that is something that needs to be sorted out, because there's a lot of problems in that, and unfortunately you can't take them anywhere. Take them to who? There's no
law.
There's no board. There's no law. The only law is it's a business, and they paid City Council. They have a license.
Yes, and we're trying to grow the economy.
Yes, and we're trying to grow the economy.
I see. That's why we have the World Sight Day, to raise awareness.
Exactly.
On this particular topics.
Yes, yes. To raise awareness on the providers, to raise awareness to the general population that look, without sight, you are done.
All right.
A lot of things can go wrong.
From your experience, what is the biggest problem when it comes to eye care? Let me start on the side of the patients or potential patients. What is the biggest problem?
The biggest problem from the patient is ignorance.
Ignorance.
Yes, lack of awareness. Lack of awareness in the sense that you just think that nothing can go wrong with your eyes. You always see.
Yes,
you always see. You wake up, you always see.
You overlook it.
You just think that you'll always see, but you can fail to see. So there's that ignorance that eyesight needs to be taken care of, and you can lose it. Then there's the ignorance on okay, so when you need help, where do you go? Because as you're saying, the first point of call is the optician, who may be complete quack.
Am I in business?
Yes.
Just in business.
Yeah. You walk in there, regardless of what you have, you will walk out with a pair of glasses. Yes, he's a salesman. He has to sell glasses. Then there is the ignorance on what are the common problems with our eyes. What are the things we need to look at? Yes, that is now from the general population. But there is also a lack of service. Yeah,
as well.
Yes, you are in somewhere in a town. Your nearest eye care provider is 200 kilometers away from you.
I see.
So, even if you have a problem, it just takes so long to find help that you have a problem.
So care providers are not enough.
They are not enough. No, by any stretch.
So people watu wanamaliza form 4 say should join.
Yes, but they need to be prepared for a journey.
For a journey. Nakusoma sana. All right, I see. Stats show that more than 1 billion people cannot see well.
Yes. Yep. But let's bring it home. That's 1 billion people worldwide.
Across the world.
In this country, it is estimated that about 250 to 300 people, 300,000 people are blind. No, they can't see well. They are blind. Blind.
300,000 people are blind.
Yes. Yeah.
All right, so that can give you a rough idea of how many people cannot see.
And remember, once you're blind, there is a family member who has to stay home. Yeah,
it affects the whole dynamic.
It affects the family. It affects your neighborhood. You are not productive. You are dependent. You have lost income. And the statistics show also that once you go blind, your risk of death is 5 times more than the average. Yeah, somebody who's blind is 5 more times likely to die earlier than you.
300,000.
Yes,
that's a big number.
And then there's another like 1 million or 2 who can't see well. So we say they are visually disabled, visual impairment.
Visual impairment.
Yes.
There's a very huge chunk of this 1 million that drives on our roads.
Oh yes, oh yes, oh yes. There are stories that I can't say on television. You know, but a good case was, you know, a guy who I operated on, and he says, "Doctor, I'm just so glad. You know, now I can see." So I tell him, you know, what do you do? I was a truck driver. Yeah, I was a bus driver. PSV Kwanzaa, those are the worst ones. The other one was a watchman. I was just thinking, I was pitting his employer. There was no watchman there.
It's ironic.
Can't see during the day, what about at night?
And this should not be funny. This should not be funny whatsoever.
Yeah.
All right. So, what is the way forward now that we have this day, World Sight Day?
I think the way forward is to talk to the listeners and say, look, you need to understand that eyesight is very critical to your life, and please take care of it. So how do you take care of eyesight? Number one, if you're hammering something and cutting something, we always recommend put protective glasses, especially, you know, artisans, grinders, people, you know, carpenters, things like those. Things can enter your eye and damage your eye. We see all the time. We see nails, we see grinding particles, we see stones, we see all manner of things.
The sparks.
So if you're dealing with high velocity stuff, buy a pair of glasses. Goggles. Yes, you just need something barrier. So that if something flies into
doesn't
your
have
eye,
to be fancy.
It doesn't have to be fancy or expensive. It's a barrier. Yeah, that's kind of the basics.
So protect your eyes.
Protect your, if you're in a field where, you know, things can enter into your eye, protect your eyes. Then you have the normal wash your eyes, which we were taught from primary. Wash your eyes is wash your eyes every morning.
When you wake up in the morning.
Yeah, wash your eyes. You want to protect your eyes. Then we have people who have diseases that can affect your eyes.
What are some of these
top
diseases?
Of the number 1, 2, 3, 4, 5 is diabetes.
Diabetes is number 1, 2, 3, 4, and 5.
Yes, diabetes affects people's eyes, but it does not need to. But people, you see, the problem with diabetes is that you see well until almost when you go blind.
So you never see it coming.
Yeah, you don't see it coming. You also don't feel it coming.
Intended.
There's no pain. There's no pain, and you're seeing well until one day you wake up and you can't see. Wow. And then when you come to us, we tell you, sorry, it's too late.
It's too late.
But then you say, but I was seeing well last month. I said, no. What was happening in your eyes has been going on for a long time. So diabetes, and I want to speak to diabetics. Every diabetic who is listening here, you really need to get your eyes checked. And please go to an eye specialist, not an optician.
Regularly.
Once a year.
Once a year.
Yes. The standard of care, what we call standard of care, is that every diabetic should have his eye exam on the day the diagnosis was made and every year thereafter.
Every year thereafter.
If they did that, we can prevent 95% of diabetic-related blindness. And the problem with diabetics, they go blind in their 40s, their 50s, at the prime of their life.
At the prime of their life.
You know, and it's you know, you have children in high school, you've just at the pinnacle of
It affects everybody around you.
It affects everything. You have mortgages, you know, maybe you've just retired, you want now to kind of enjoy, you know.
Sight is very important for the hustle.
So there are diseases that affect eyes. Then now there are issues now of just growing old. So we say once you hit 40 or at least 50, have an eye check once a year. The eye has pressure. And pressure is the second leading cause of blindness. That's why your eye doesn't collapse like a balloon. You know, it has a pressure inside that maintains that eye so that the atmospheric pressure doesn't just
crash it.
Yes.
So it has to balance that.
That pressure sometimes goes up and the nerve dies. It's called glaucoma.
Glaucoma that is what we call glaucoma.
Yes, and it's the second leading cause of blindness.
Is it correctable? Can you correct it?
It is not treatable, but it is preventable.
It is preventable.
But then it means we have to diagnose it before you go blind. Otherwise, once you go blind, you're blind.
So most of these things are preventable.
They are preventable.
But they cannot be corrected. So it's very important to
check. Some of them cannot be corrected.
Some of them, let's say some. Yes. So it's very important to get your eyes checked.
Yes, once a year.
Once a year?
Just go for an eye check, especially once you have 45 there. Yeah, once you start putting books there and here, trying to figure out.
Or your phone there and here.
Then you know it's time to see somebody.
All right. Another thing that happens is you just walk into a shop in town.
Yes.
You buy glasses for swag, not for sight.
Yes.
You just buy glasses for swag.
Yeah.
And I remember my dad used to tell me, you don't know what you're putting in front of your eyes. It's a risk. You might be distorting your vision somewhere.
Yes.
Would you advise people to just buy whatever?
First of all, people have to understand they see with their eyes. They don't see with their eyeglasses. In fact, I've always thought I should have an advert. You see with your eyes, not with your glasses. And you put a big glass in front of you. So you see with your eyes, not with your eyeglasses. So you have to make sure that your eyes are good. First, take a look at your eyes before you figure out that it's your glasses. So you need to go to somebody who will tell you this, who will look at your eyes and tell you it's a focus problem, so go and get glasses.
All right.
Yeah, the problem is that it's easy because it's so accessible and easily, you know, you just walk into any optical shop. However, having said that, a well-trained optometrist and an ethical optometrist should do a basic eye exam. They should check your pressure, look inside, look at your nerve, look at a few things, just make sure you're fine. And if they detect something, they should refer you immediately. Unfortunately, that's not what happens. Them, they're looking at sales, they'll sell you, they don't even do the basic tests, and that is why we have all these problems.
All right.
Yeah. But not all of them. We have a few well-trained.
Yes, let's not spoil all the fish.
Blanket,
all right, blanket. Would the dark shades affect my eyesight if I wore them over time?
No, not really.
Or not really?
Yeah, not really. So there is what we call UV protection. And a whole host of other things that we talk about eyeglasses. And I say, look, unless you are a fisherman or a seafarer, or unless you are in snow, UV protection is just, it doesn't really matter.
Doesn't really matter.
Because unless you're looking at the sun, why do you need UV protection? On land, you don't get reflection of UV once light reaches the ground. But on the sea and in snow, it reflects.
So the next time you're going for holiday in the coast, you better carry some UV protection.
Yeah, but if we are going to be out there in the ocean, at the beach, nothing is happening. Okay. The other big thing is also we find a lot of, you know, now during COVID, everyone is on Zoom, everybody is on online classes, you know, and there are a lot of issues about eyes because people are on a screen 24/7.
24/7.
Yes, and so you'll find now there are glasses being written blue filter. I don't know, there are glasses for computers, and I want to say there's no evidence for that. That is just marketing.
That is just.
However, the way God made us, Barry, God didn't make us to stare at something all day. That's not the way eyes are designed. It's not natural. It's not natural. In fact, if you stare at something, you don't blink often because you're concentrating.
And blinking is part of the
blinking
care.
Helps to moisten the eyes. So what happens is you get dryness of your eyes. And that is what gives all these problems you hear. Sensitivity to light, unasikia kama kuna mchanga ndani, unaumwa huku, you're tearing, your eyes are red. It's because, you know, you're on a laptop, then you go on your WhatsApp, then in the evening you're on I don't know what. So
it's very important to take a breather. It's very important to
take a break. Yes.
From your computer.
And don't take a break and go to WhatsApp.
Don't take a break of one.
Close your eyes, walk around, count butterflies, see the trees.
Okay, another question that people always ask, is it good to watch my TV in the dark? To turn off the lights at home?
No, that one doesn't matter.
That one doesn't matter. I can still enjoy my TV.
An eye is designed to accommodate various light levels.
An eye adjusts.
It adjusts. Yeah.
So the eye is quite gifted. All right. So from here, I see this day was created to raise public awareness of blindness and vision impairment as a measure, international and public health issue, influence government and ministries of health to participate and designate funds for national blindness prevention. I'm focused on this. A lot of funds was directed to COVID. A lot of funds has been directed to education now that kids are going back. Are we getting a substantial amount of funding when it comes to eye care?
No. So
that one you can say outright.
Yes. Yeah, we don't get anywhere where even, we don't get very little.
We get very little.
Very little. And I'm not faulting the government because you have, when you have limited funds, you take care of what can kill people.
Priority.
Yes. Eyes don't kill.
Don't kill people. They can still survive. But without your sight, it's very hard to
without
build.
your sight, it has been shown on an economic study that the investment you put in eyes, you get back a fourfold return.
Fourfold return.
Yes.
Break that down.
400%. Let's do a simple case study. If you have a person who is blind from cataracts at home,
yes,
the grandchild has to stay there, or there's somebody there has to be a caretaker. So first of all, that caretaker has lost time and revenue. Yes, taking care of that man, and that man is not generating nothing. And that man will hit his foot and form a wound, which then has to be taken care of at the dispensary.
You keep losing, spending money.
Yes. If that guy gets their sight back by investing 10,000 bob for a surgery, sight restoring surgery, the person, the caretaker, is freed. That immediately becomes income generating. Yeah, even if it's just taking care of the animals. That person is no longer dependent. In fact, he now becomes a productive member of that society. In that 1 year, that whole homestead and village changes.
Just because of one.
Just that investment. And so sight restoring interventions are very, very, very impactful. Much more impactful if you look at just investment per dollar or per whatever it is than any other condition.
It reduces the stress on the person who has...
It gives a huge social return and an economic return.
Wow.
Yeah. Number two, it's been shown worldwide that 30% of road traffic accidents are caused by eyesight problems. Yes. So investing in eye health might even impact our road safety
in the long run.
In the long run.
So it has a lot of impact in different aspects, in different fields.
Across society.
All right, so we need to take care of our eyes more.
Yes.
And we need more funding in this direction.
Yes, yes.
All right, somebody might be watching and they want to be like you.
Yes.
You took... So you studied your first degree, 6 years, Nairobi University.
Yeah, yeah.
Then you did your masters.
Then you did a masters, that's another 3 years. Then and in between you have to work a few years. And then for me, I have specialized in one particular part of the eye. It's called the retinal surgery. It's another 2 or 3 years of school. I mean, my children told me, we don't know what we want to do, but we know what we don't want. You've been in school all your life.
You don't enjoy nothing, but at least you're helping the general public. It has an impact.
I say, Barry, without fear or shame, that I give glory to God because what I am was a prayer answered. My dad went blind from diabetes, and so
it's a personal.
So I know diabetes from both sides. I have lived with somebody blind at home, and I have seen blind patients. And I prayed and I said, Lord, this is what I want to deal with. I don't want anybody's father going blind like my dad did. And God has answered that prayer. He's opened doors. I got scholarships that I didn't even apply for. And really I give him thanks. But nevertheless, there is a road and a journey. And people who aspire to be where we are need to know and count the cost.
All right.
Yeah, but it's a very rewarding career.
Very rewarding career.
To give sight back to somebody is just heavenly.
It's just heavenly. When people tell you, thank you, doctor,
when
now
they open their eyes like this and they
see.
Wow.
It's very fulfilling.
Yeah, it's very fulfilling.
Wonderful. So you ran an eye hospital?
We ran I had a private clinic which we then grew into an eye hospital. So it's called City Eye Hospital. We also have outreach programs. We go and find people who are blind and bring them in, operate them at no cost to them. We meet that cost. But now we have partners. We had the Hilton Foundation was one of our partners. Fred Hollows was one of our partners. And it's, well, okay, those programs now have come to an end because of COVID, because now we can't congregate, we can't bring people together. We also have a program that screens, it's a camera-based screening program for diabetics. We have a special camera, it takes photographs. We're able to know immediately whether you are at risk of going blind and not. In fact, that program is probably going to grow digital, so that now we then use artificial intelligence. You know, that's where all this technology then comes. So that you take a photograph, an AI process tells you whether you're normal or not.
Oh, so I can do it from home?
You can do it
remotely?
Yes.
All right. So the future is bright.
The future is exciting.
All right. Do we have enough innovators in this particular field in the country when it comes to...
First of all, do we have enough doctors?
All right, we need to start with the
before innovation, we have a problem. We have about 160 ophthalmologists. If you take a population of 50 million, that is, even if there are 200, that is one doctor for every, what, 250,000 people.
That is humanly impossible.
That is not possible.
You cannot, even in your lifetime, you can see 250,000.
Out of those 60% are in Nairobi. So when you now take that ratio for the up country, it's even worse.
I get the point.
So there are some counties that don't have an eye specialist.
There's a lot of improvement.
So there's a lot of work that we need to do, and that's why we have World Sight Day, to bring to fore such imbalances, such needs, so that you know, we galvanize resources to be able to do this. And then we need nurses, we need optometrists, we need opticians, we need clinical officers. We need so the workforce needs are there. But I always say, look at what M-Pesa has done for us. It has helped us leapfrog very many years and achieve a lot just by that technology. And that is what we actually need in healthcare. We really need to leverage technology so that we're able to serve a lot of people quickly. Otherwise, if we wait for organic growth, you know, the normal traditional ways of solving problems, we don't have that time, and we are too far behind.
We are too far behind. The world is so
the
much
world is
far.
moving, and it keeps moving faster every year.
So we need to catch up.
We need to use technology to, you know, get this process going. And I think one of the things that COVID has done is shown people that, you know, innovation can happen, problems can be solved, life can go on using technology, and we should not now go back. We should use this to leverage, you know, get 4G everywhere, get healthcare on the digital, you know, platform.
Because people have phones now.
Yes.
The population of Kenyans with mobile phones, actually smart mobile phones, is very high. I'm told it's more than 80%. Kenya is laughed at in the world because when we go to conferences, you know, people say that country that has more phones than toilets. You've had this firsthand.
Yes, on the world platform.
It's a good thing. Information is more important than toilets, if you ask me. Anyway, on behalf of the people you represent, what are you doing to commemorate the day today?
So we unfortunately, we were supposed to have a walk. We were supposed to blindfold people from Parliament to walk to the Ministry of Health.
So that they see.
So that they understand what it means to have, you know. Unfortunately, today's COVID and CS and the whole group of Ministry of Health, they're in Kitale. So the walk can't happen, but there's going to be an emphasis on eye care from the CS, from the highest level in the Ministry of Health. We are going to commemorate people, partners who have worked with us. Standard Chartered, you know, Standard Chartered Marathon, seeing is believing. That money raised went to eye care. They did a lot of work.
We need more initiatives like this.
You know, Fred Hollows, Operation Eyesight Universal, CBM. There are many partners who have worked with us and helped us. And so there's going to be also a launch. There's a strategic plan that is being for the next 5 years in eye care, which should be ready this year. So the CS is going to lead the nation in commemorating World Sight Day and highlighting the achievements and also enumerating the challenges that we see.
I'm glad it's happening from the top.
Yes.
I'm glad we have very able gentlemen like you.
Just another barrier.
This right there.
Yes.
But for those who are watching and would like to get in touch with you,
Yes,
because they probably have a relative
yes,
who's suffering, or
Yeah.
they're suffering themselves, how can they get to you?
Well,
your camera is that one.
So,
that one.
so CTI Hospital is on Gong Road, opposite Traffic Police. It's a straightforward place. That's a general hospital. There is no, you just walk in. We open Monday to Friday. Right now it is 7 to 1 p.m. We have a private clinic which is by appointment. You can get us on the social media. We are on Google My Business. We have a website. We are on Facebook. Just go there, you'll find us.
All right.
Yeah.
You're everywhere. CTI Hospital.
CTI Hospital.
All right. Thank you very much for coming through.
Thank you, Barry.
And keep doing what you're doing.
It's been an exciting
conversation
discussion.
right there.
Yes.
All right.
Yeah.
Say hi to the kids for me.
Yes.
Do you happen to listen to hip hop music by chance?
No.
No. What is your kind of music?
I'm a gospel man.
You're a gospel. There's gospel hip hop. Very good gospel hip hop.
Gospel music. I like jazz.
Oh, you like jazz music?
But most of the time, bana, ninafanyia Wakenya kazi.
Unafanyia Wakenya kazi. There's no time for music per se. All right, but thank you very much for coming through. We appreciate you. We are still having that conversation on Facebook. We are asking you to tell us Calligraph Jones' favorite line. Your favorite line from Calligraph Jones. Let's vote for him. Let's help him bring this award nyumbani. We already have the world record for the marathon. We already have a world record for so many races. Let's bring this BET award home as well. We'll be back with some more of Hip Hop Thursday and try to do something to help commemorate this World Sight Day. It could be a tweet. It doesn't have to be so much. Just a tweet and create awareness. We'll be back with some more of this.